Again, I welcome you to today's session about public health. I'm called Mr. Kato Alex Male. As always, I'm a public health officer, and I enjoy research. So today's today's lecture is about public health surveillance. We have been going through a lot of course units and programs about public health. We have had lectures about public health. So I guess we know what public health actually means. Now, surveillance, of course, comes from the word survey, surveying, just something like that, surveying. Yeah. So now, surveying is like we want to collect data, you want to carry out a survey, you want to investigate something. You get it? Eh? And then surveying, we are targeting a certain group of something. It may not be humans. I'm just getting from the word survey what survey means. It may not be humans, it can be something else, but so long as it is in groups. You get it? Eh? Now, when it comes to surveillance, you want to carry out something, but this must be ongoing. Now, the difference from surveillance and surveying, of course, surveillance is a subset of surveying, but surveillance comes with that aspect of an activity which is ongoing. If we continue to get the discussion of this, we want to have, we look at public health surveillance as the ongoing systematic collection, analysis, and interpretation of data integrated with the timely dissemination of this data to those responsible for preventing and controlling diseases and injuries. You get it? Eh? There is that aspect. There is this aspect of ongoing. I hope we can all see that. There is this aspect of ongoing. Something must be ongoing. You can be following with my cursor. You get it? Eh? Ongoing, whereby it's only at a point of time, but something ongoing. Then systematic. It should be organized. You get it? Eh? Stepwise. And then analysis. And then interpretation. We go on and analyze each and every data we collect. We go on to analyze and interpret that data with respect to the indicator to the community we are dealing with. Remember, you as a public health officer, you someone who wants to enter public health, you someone who wants to come and do something in public health. Your patient is the community. Your entire patient is the community. Therefore, in surveillance, we want to carry out all these steps in data management, and then we must any process which involves data also includes dissemination. Dissemination is the key. Dissemination of data, dissemination of findings. Because if you don't disseminate your findings, then what was the reason of surveillance? You get it? Eh? So I want you to understand the first aspect of surveillance. The first aspect is ongoing. It must be ongoing. And then it is also called epidemiological surveillance or disease surveillance. You know, when we are dealing with epidemiology, we deal with the 5 aspects. The first 3 aspects are the PPT: person, place, time in epidemiology. Now, we want to answer these questions. If you are carrying out surveillance, if you are carrying out public health surveillance, you must answer the 5 questions of the first 3 which come from person, place, and the time. You get it? Eh? The person is who, which population is affected. You get it? Eh? Which population are you carrying out surveillance from? Then place, where. You get it? Eh? The who, the where. You get it? Eh? Where, which area are you carrying out your surveillance from? Then the when. You get it? Eh? When are you carrying out that surveillance? You understand? Eh? Yes. Now, the other 2 questions to answer are the how and the why. You get it? Eh? Now, the how and the why in the surveillance are answered by the analysis and interpretation of data. That's why we say public health surveillance is also called the epidemiological surveillance. Now, as we continue with the public health surveillance, we have what we call public health informatics. Yes? Now, this is the systematic application of data, technology, and information systems to public health surveillance and research. How are you integrating ICT into public health surveillance? We have seen what surveying means, what surveying does. You are going to deal with your patient in the community, a community with a very huge population, of which you're not considering the entire population in that community, but you are specific, you are even specific in ages and sex. Maybe you want to target females who are in the reproductive age. You get it? Such cases, if they are done manually, such data, if it is done manually, therefore, it becomes really hard for you, the public health officer or the epidemiologist. Therefore, how are you integrating ICT into this activity? When we go on the historical perspective, where did the public health surveillance come from? Now, we are going to give you this origin, which is evolved from monitoring infectious disease outbreaks in the 19th century. And I'm bringing you this example of John Snow in 1854. This is a very good scenario, by the way. You cannot tell me that you are a public health officer when you don't know John Snow's scenario. You get it? Even when you people go into public health practice, even when you go on to practice public health, one of your references will be the John Snow's contribution. Therefore, what did he do? He mapped cases and identified a contaminated water source. You get it? He mapped cases and identified a contaminated water source. Now, there was a community in London, and they had a certain water source. You know that, like community tanks. I hope we have them there in Juba. We have and all your towns where each one of you is living. Now, these community tanks, they be supplying water to the community. Usually, water can be obtained from underground or can be obtained from rainy water. Now, the people in this community, there was a cholera outbreak, and they didn't know where it was coming from. You get it? And we didn't know which populations were even affected. No one knew. John Snow came out with a public health surveillance system, which was used to map cholera cases. Remember, cholera is a contagious disease to start with, which comes from sanitation. You get it? Therefore, if we don't get who are the cases, if we don't identify our cases, this condition will go on to spread through the entire community. You get it? John Snow, when he mapped them, his surveillance system was used to locate these cases within London in that year 1854. Now, this is an example of active surveillance. We are going to look at what the types of surveillance, and that's when, so don't be worried of this term active surveillance. We are going to see what are the types of surveillance. Going forward, we have the purpose now. Why is it important to carry out public health surveillance? Number one, to estimate the health status and the behaviors of a population. You understand? When we carry out surveillance, we are going to come up with data which is going to help us in identifying indicators of possibility of a disease to occur in an area. We might have an area whereby, considering those towns which have those rich people, those people, they may not have time to walk. They will not have time to walk from Monday to Sunday, Sunday to Monday. To work, they're always in vehicles from home to school, school to work, maybe work to home, like that. Such people, maybe you as a public health officer, you identify that in such a community, these people might be at risk of developing obesity and high blood pressure or hypertension. You get it? And other conditions related to the cardiovascular system. Now, you come up with a surveillance system which is going to identify the most susceptible populations, those at a very high risk. Now, this shouldn't be a one-time thing. This shouldn't be a one-time process. It must be continuous and ongoing. Surveillance is characterized by its characteristic of ongoing. I hope we know that. Now, the other purpose is to measure the need for interventions and their effectiveness. I think this one is clear. We need to see what we can do and also evaluate it. Then also to empower decision makers with timely and helpful evidence. Remember, since your patient is the entire community and it includes you can be helped by non-government organizations, government institutions, and the others. You get it? Even you, individual, public. You get it? In case you want to, to introduce a new system within that community, we need data, we need evidence. You get the point? We need evidence. You understand? Yes. So we need that data to help us in decision making. Whether we are going to quarantine, quarantining. It was very common during the COVID-19 period. Yes. So if we are to quarantine, who are those to be quarantined? You get it? We are under the decision making process. Who are those to be quarantined? For how many days? Where? You get the point? Then to protect against epidemics like the HIV, like the severe acute respiratory syndrome. This is SARS. SARS is severe acute respiratory syndrome. Very, very common during the COVID-19. But it wasn't, but you must take this point that it wasn't first identified during the COVID-19 period. You must know that. It was there long time ago, though it has 1 and 2 variances. Now, the other purpose is to for rapid early warning systems for acute infectious diseases such as the SARS, the one I've just talked about. Maybe if public health surveillance was carried out very well across all highly susceptible regions in the world, maybe we would have prevented the pandemic from occurring. So when you carry out public health surveillance, we come up with the rapid warning systems, which can help us to identify the highly susceptible populations, the age groups which are at a very high risk. You get it? Of developing, even those when developed, even those that can cure easily, those that will not cure, those will be affected very badly, like that. Now, when it comes to the economics of public health surveillance systems, here we provided you with the examples to determine this economics. The first example is the SARS outbreak. Now, that's why I tell you that it was there in existence. You get it? This one of COVID-19 was SARS-2, but now there was SARS in the previous years. Now there's this of 2003, whereby significant economic losses due to ineffective surveillance systems. Here we are trying to see the cost effectiveness in surveillance systems and how we can calculate and recalculate. Then another example of that for global public health good, whereby surveillance systems as a global public health good with equity concerns for fairness and equity. This comes in if this one of 2019 started in China. Maybe if China had good surveillance systems, maybe the COVID-19 wouldn't have affected the entire world. But we don't know whether they are good or bad, but either way, they didn't see it coming. Therefore, it affected the entire world. Eradication campaigns are costs borne by developing countries versus benefits for global health. You get it? That's why you see those developed countries, the first world countries, they put in much to situate that even the developing countries, especially those in Africa, you know that those in Africa, many countries are still developing countries, still third world countries. Therefore, we are trying to look at the fact that if we leave diseases to just take over these developing populations in developing countries, we might end up affecting the entire world. Therefore, you see them, organizations coming into Africa, trying to introduce those campaigns to situate that we have conditions eliminated or eradicated. Then we proceed now to the types of surveillance. Now we have to start with is active surveillance. This is the same as primary surveillance. Yeah, active or primary surveillance. Now, this involves regular contact with health providers or the population to collect information. What we mean here now, listen carefully. You want to engage the communication. You want to begin from the word go. Sorry, you want to engage the population. You want to begin from the word go. That's why it is called active surveillance or even primary surveillance. You want to begin from the word go. You get it? So you engage the population itself. and introduce this surveillance system. When it comes to passive surveillance, you want to it is also called the secondary surveillance. You want to rely on data which is already available from the populations. Here, you're not going to engage the population in a passive surveillance. You're not going to engage the population, but you're going to use data collected from the population. You get the point? You're going to collect data to get data collected from the population. Usually this data is there in hospitals. You understand? If I can give you an example, I want to introduce a system in my community. I want to go into hospitals and clinics to get data on hand hygiene related conditions. Get it? I want to get that data as an example of passive surveillance to go on and monitor the trends in hand hygiene diseases since 2018. Even through the COVID-19 period, even after the COVID-19 period, we see how it has been coming out. You get it? If I wanted to perform active surveillance, I would have gone to my community to collect data on hand hygiene related conditions. But now I want passive because of there is this advantage given here, cost effective. It is cost effective, but they are but with lower data quality control. You get it? Eh? Now, for my case, I want to target cost effectiveness, and I believe I want to go and get data since 2018. You get it? And then come up with that surveillance system to monitor hand hygiene related conditions. Now, the other third type is the syndromic surveillance. This one uses clinical features with the lab diagnosis to monitor syndromes. You get the point? It is quick and it is inexpensive, but it needs more specificity. Yeah? You must use the methods or tools which are highly specific. Otherwise, you may many conditions have similar clinical features. You get it? Even having a wound on your body is enough to give you headache. You get it? Having malaria is enough to give you headache. Typhoid is enough to give you headache, and the other common conditions. You get it? So if you want to use the headache as one of the clinical features, such a method will not be specific. You get it? Eh? So needs a method which is highly specific. You get it? Eh? Yes. Joint pains combined with the nausea and vomiting. You get it? Such that in case we have nausea and vomiting without joint pains, we shall say this is not malaria. We shall just go on to press to identify other conditions. The other one was types of surveillance, but now we are looking at types of surveillance systems. Other types of surveillance systems, we have routine health information system. We have the health HMIS, HIMS, health information and management system, categorical, integrated, and then behavioral risk factor systems. Now, the routine health information system, this one is passive, and it has a regular, it involves regular disease reports. You get it? Literally, any surveillance system would have a routine health information system because it is passive, but again, we collect these reports and see how has malaria trended within the month of September. You get the point? How has such and such a condition trended within this period? You get the point? Therefore, we need it. It is passive, but again, we need it because it specializes out that particular conditions, and it is routine, as in at a regular basis. Then the HIMS, the information management system, it is passive also, and it covers financial and administrative processes. How expenditures have been within this period that we are monitoring. You get the point? We are monitoring on this we are monitoring on this condition, or we are monitoring on this population. You get it? How is administration and how financial resources how we have utilized them. This helps us in evaluation and also for assuring cost effectiveness, as well as avoiding the case of overutilization of resources, yet there is no yield. Then we proceed to categorical. This one focuses on one or more diseases, but even these diseases, even if it focuses more than one, they must be related. You get it? It either focuses on one disease or more than one related diseases. You get the point? They can be related by the symptoms, or they can be related by the etiology. You know, etiology is the cause. They can be related by their cause. Then when it comes to integrated, this combines active and passive systems to monitor multiple diseases and behaviors. Like I told you that passive systems are also called secondary systems. You'll not engage the population. Then active systems is where you will have to engage the population, and I guess that point is very clear. Then we proceed to behavioral risk factor surveillance system, where this one now conducts an active surveys to measure behaviors that cause disease. Now this one goes on to engage the community. This one goes on to engage the community. Get the point? Yeah. We try to find out what are the general causes of conditions that are affecting this certain particular community. Then now we go on to discuss the sentinel surveillance systems. This is the type of this surveillance system that is used when high quality data about a particular disease cannot be obtained through passive surveillance. This goes a step further by selecting specific reporting units, such as hospitals, clinics, that are likely to see cases of the disease in question. These units are chosen based on factors like location, size, and the quality of the laboratory facilities and the staff. Now, to give you a clear picture of sentinel surveillance systems, here, still I'm going to base on COVID-19 so much because most of us here are a bit young, so it's the only pandemic that we have seen that covers worldwide. Now, we want during that period, governments of different countries were informing their populations that if you see someone coughing, please report that person to the hospital or report that person to the community leaders. You get the point? If you see someone sneezing, or even if it's you who is sneezing, be honest and report yourself. Even if it is a family member, report that person to the leaders or community leaders because they are easily reachable, or go on to the hospital, to any health facility. You get the point, and report about that. They will then now this surveillance system is going to monitor this community through as if it is engaging, as if it is not engaging. I don't know whether you get my point. We have two scenarios whereby one is engaging the community. Secondly, we are not engaging. The one is active, then the other is passive. Now, this one is as if passive, as if active. We who want data will obtain it from the hospital, but we are directing the hospital. We are specializing on the condition. We want this hospital to report. You get the point, eh? Yeah, that's now how specific sentinel surveillance is. In case there is any question, please, we shall raise these questions at the end of the presentation. For now, I want us to first proceed. Be noting. In case there is any question, be noting. Then population-based surveys in surveillance. These are repeatedly. Okay, they are critical in public health data. For example, HIV prevalence surveys and demographic health surveys. These require careful attention to methodology, sampling strategies, and interviewer supervision. For this case, where we can have a community and then carry out prevalence assessment. We carry out research studies to assess prevalence of that particular condition at this particular time. You get it? Then, after 3 years, we do another survey, still on the same community, on the same disease in question. You get the point, eh? Yeah, on the same population. If it is an age group, on the same age group. If it is a sex, on the same sex. You get the point? Yeah. Then when we go on to laboratory-based surveillance, This is the most advanced level of infectious disease surveillance. It identifies pathogens, for example, Salmonella. You know, Salmonella causes typhoid, Salmonella typhi, and it's Shigella. Shigella causes dysentery. I hope you know this microbiology. I just hope we know this microbiology. These are bacteria. Salmonella for typhoid and then Shigella for dysentery. Then now this laboratory, it is laboratory activities are the most specific activities. Remember, we said one of the key requirements in surveillance systems is the high specificity level. It must be highly specific. You get it? Yes, it's because like I told you, if you're based on clinical features, most diseases have similar clinical features. You get it? So if you over based on clinical presentation, you get the point, on their symptoms, you may not be that such a system is not highly specific. But then laboratory surveillance is very specific because they will go on to collect even blood samples to identify that bacteria, to identify that microorganism within blood samples. Even if it is symptom, you get it? Even if it is urine, they can go on to collect that data, those samples, and then examine and obtain highly specific results. It provides rapid detection of epidemics through central reference laboratories, which we have in our towns. They are mostly in towns. Then molecular subtyping for disease surveillance. This enhances lab-based surveillance by distinguishing outbreak stains. Yes. For example, PulseNet, which is a CDC. CDC is a Center for Disease Control. So PulseNet is a CDC-led network that shares molecular data globally. Global adoption of genotyping facilitates multi-continent outbreak detection. Now, with this molecular subtyping, let me give you an example of human papillomavirus. I don't know whether you have covered this in your microbiology, but human papillomavirus is a virus which is mostly known for causing cervical cancer of the cervix. You get it? But then it has over 100 stains. It has over 100 stains of it. But then among those 100, they are the ones we call high risk and the ones we call low risk. You get the point? For example, high risk can be 16, 18, HPV 16, HPV 18, like that. Then low risk can be HPV 6, HPV 11. Why am I bringing this? Because that's what we do in molecular subtyping. We don't want to know that human papillomavirus is endemic. No. Which stain exactly? Which stain of the virus exactly is endemic in that particular area? Now, this is what molecular subtyping does in disease surveillance. Even if it's malaria, which specific species? You get it? Because causing malaria, we have Plasmodium falciparum, we have Plasmodium malariae. You get it? And the others, you get it? So which one specifically? That's what we do in molecular subtyping. We go on to be more specific and specialize which stain. Then environmental, now we come back to our community. We leave the laboratories. In environmental public health surveillance, here we monitor hazards, exposures, and health outcomes. You got the point, eh? Remember, public health stands on its first principle as risk factor assessment. We always want to prevent something before it occurs as public health officers. We have that passion. We don't want this to occur. If it is accidents, where would it come from? If it is a disaster, if it is, you get it, where is it coming from? We want to prevent it before it occurs. You get it? Epidemiologists, these are advanced public health officers. You get it? So we monitor hazards, exposures, and then health outcomes. Now, when we get this data, we can try to identify the high-risk populations in case a hazard has occurred in an area. We want to find out what other areas are highly susceptible to the same hazard. We relate health outcomes to specific environmental hazards. Then challenges with this EPHS, environmental public health surveillance. One is difficulty in linking environmental hazards to outcomes due to complex disease processes and multiple causative factors. Because here, you are not so much specific. You get it? Eh? You're collecting any information so long as it is hazardous from the community. You get the point? Eh? Therefore, it becomes a bit difficult to do that linkage. That's why I said now, your system must be highly systematic. You get it? Eh? Yeah. Then limited information from existing data sources. For example, the public alarm can skew police. Yeah, we don't have okay, limited information just as a broad view from existing data source. They don't provide enough data on environmental PHS, public health surveillance. Then the third one is biological markers, challenging to monitor, because now here you have gone back to the community. You're not in your laboratory, You're not engaging any laboratory officer. You get it? Eh? So it may be hard for you to monitor biological markers. Then we go on to environmental still. Methods of environmental PHS. When I say PHS, I mean public health surveillance. Methods, the first one is exposure surveillance. This one includes personal monitors and modeling, and then routine biomonitoring. For example, blood lead levels. And this is often limited to specific countries, yeah, because it is really expensive. So say in certain countries, in certain population settings, it might not be affordable. You get it? Eh? Yeah. We can target in exposure surveillance. Let me give you an example of people working in welding areas. People welding, welding, metal welding. Yeah. So people working in welding areas, they are at a high risk. They are exposed to heavy metals. For example, lead. For example, mercury. You get it? Eh? Now these people, they can be subjected to this exposure surveillance. They can be subjected to routine assessment, examination, and monitoring to assess levels of these heavy metals in their blood, such that we can determine who are those ones at risk before the condition actually occurs. Then we go to injury surveillance. Here, injuries are among the top causes of death and disability worldwide. I think that one is very clear, whereby higher death rates from injury in developing countries. Yeah, injuries, all types of injuries. We are categorizing all types of injuries here. Yeah, whereby we have unintentional injuries and then fatal injuries. Whereby unintentional injuries can be accidents, falls. You get it? Eh? Yeah. Then other injuries can also be violence related. You get it? Eh? Injuries can be violence related. For example, physical violence, sexual violence, psychological violence. You get it? Eh? Remember, in public health, public health has generally three targets on a community. We are targeting the physical aspects of the population. We are targeting the social aspects of the population. We are targeting the psychological aspects of the population. These are the aspects that public health is targeting on a community: psychological, physical, and social. You get it? Eh? Yeah. Therefore, any injury, we categorize it in that line. Accidents, if they are to occur, they can cause both. They can cause all. Physical injury, they can cause mental or psychological injury, and can also cause social. Then going forward, we have the fatal injuries, which are captured through forensic data and death certificates. Usually, this one, remember, in the modern world, if anyone dies, we go on to avail death certificates. In the death certificate, we identify what killed this person, and maybe for how long have they had the condition. Has it been immediate death? You get it? Eh? This helps us to identify death-related indicators and also obtain death rates from a certain condition or from a certain injury. Then surveillance as another type, surveillance for biological terrorism. This one helps us in early detection, timely reporting, pattern recognition, and then new data types. Whereby in early detection, you identify and manage outbreaks of biological terrorism. Of course, early detection is very important. I've discussed this. I don't want to over repeat it. Then timely reporting, I talked about dissemination of any findings. Then pattern recognition, this helps us to know what are the hotspots. What are the hotspots for such and such a condition? We can go in a country and locate hotspots for HIV. That HIV is highly prevalent. Maybe let me consider our own South Sudan, highly prevalent, maybe in Juba here. You get it, eh? Or in such and such a community, or in such and such a state. You get it, eh? So we try to locate patterns, to identify patterns for a condition, and the biological terrorism in this case. So you use analytic tools to detect potential outbreaks early. You can know that in such and such an area, you can easily suspect this to occur. Then in new data types, these include healthy productive purchases and symptom reports. When you carry out such a surveillance, we can prepare ourselves when it comes to drug. Even the drug manufacturers can easily know that such and such a drug is highly needed in September or in December, because in December, that's when you have very many cases of typhoid. You get it, eh? Yeah. Then surveillance on refugee populations. Remember, you people, you public health officers from here, as you graduate, you'll work in refugee area, in areas with refugee populations. Therefore, surveillance in refugee populations, whereby large displaced populations in camps or moving for resources. Now this one talks about refugees. Then these people suffer with the social stress and competition with the locals, with those they are found in the community. Social stress, they can't socialize so well. Yeah, they are discriminated. Such psychological related conditions, stress, stigma, discrimination. You get it. Then lack of pre-existing administrative structures within these refugee populations, complications from military activity and hostile environments. Sometimes they may fail to adapt. You get it. So as a public health officer, such a community is very important to you once you are going into them. Then why do we call out PHS in refugee populations? Because of the need to effective data collection and there is need for effective data collection and collaboration. You get it, eh? Yeah. There is what we call interprofessional collaboration or integration, whereby you, a public health officer, works with other technicians, for example, those ones in the laboratory, community leaders, to see to it that we help these populations, to see to it that we create an impact. Then challenges in refugee surveillance. Number one is environmental degradation, whereby there is high use of fuel since they are located in distant areas where they are new. You get it, where they have not been before, for constructing them, temporary housing, and then water pollution also in these refugee populations. Then social strife, whereby there is competition for jobs, exploitation, and violence. Now, these ones are the very, very things we see in our communities. The refugees which come in our communities, those who come when they have not been there before, you have been seeing such things occurring. And then even those who try to help, they have also been going through these challenges. Then complicated assistance, whereby we have uncertainty due to conflict and instability. They are unsettled. You get it, eh? Yeah. So really assisting them becomes complicated. Then another challenge comes in data collection, whereby simple data can be effective for planning and monitoring. Though now the biggest challenge with refugee populations is because they are new in that area and they are not used maybe to the environment and then the people they have found there. Goals and principles of PHS. I told you when I say PHS, I mean public health surveillance. So goals and principles of PHS, its primary goal is to identify and eliminate preventable causes of morbidity and mortality. Mortality we are talking about with death, and then morbidity we are talking about with disease. You get it? So diseases and prevalence. So we identify and want to identify and eliminate. I told you public health wants to prevent something before occurring. That's what public health wants most. So planning and requirements. in public health surveillance, you want to use existing knowledge about demographic patterns and health indicators. In different countries, they carry out census and they provide us with baseline data. In Uganda, they have just carried out their national population and housing census for 2024. So there is baseline data that you can use as part of the existing knowledge, and it is authentic. You get it? So you can use it to give you the demographic data. Why? Because you're not going to the population and you want to first find out the age groups. You want to first find out sex, maybe how many females do we have? You get it? No, you just go into the community and introduce the surveillance system, and it will give you proper planning if you use the available existing knowledge. Then avoidance of common errors in relief planning, of course. This one is very, very crucial as one of the principles. Then surveillance principles, we have data collection, data analysis. I talked about this at the beginning. I don't think I have to repeat that. Then response to data, and then assessment of response. Of course, we need to get feedback, and then from the data that has been analyzed and disseminated, and then we assess that response to that data. Then importance of retrospective evaluation. This, retrospectivity, something which is retrospective, it means like going back in time. Prospective is going in front, then retro is going back. So this helps us to learn from past efforts to improve future responses. You cannot tell me that you are introducing a surveillance system when you don't know what has been in existence. That's why at the beginning we began with the history of public health surveillance. We begin with those with these people who did something in public health surveillance. You see, these vaccines, they are introduced because of the available surveillance data. You get it? Vaccines, new drug treatments. You get the point. Then chronic disease surveillance systems. Now here we are trying to investigate on chronic diseases, usually the non-communicable ones, hypertension or high blood pressure, asthma. You get it? Pulmonary obstructive conditions, conditions which obstruct the lungs and airways. You get it? And the other non-communicable conditions, especially those ones which are cardiovascular and others. Now, in chronic disease surveillance, this is NCDs are major global public health issues, that cause significant morbidity and mortality. We know that people die without knowing that they have these conditions. Then forecasts, it has led, increase the burden of NCDs in the developing countries by 2020. We expected this. This was expected. Then challenges with the chronic disease surveillance systems. Number one is data collection, because there is difficulty in acquiring accurate morbidity and mortality statistics. And then resource allocation. There was in fact, very high need for reliable data to inform health policies and interventions. Then when it comes to the essential attributes of surveillance systems, I talked about specificity, and then we have sensitivity. Any system should be highly sensitive and highly specific. In sensitivity, we want it to detect any small change in the condition under question. Any small change in the condition under question, that is sensitivity. Then specificity, we want it to detect only changes in the condition under question. I want to repeat this so that you can understand. In sensitivity, we want to detect any small change in the condition under question, and then specificity, only the change. In other words, if there is any other change in any other condition, the system should not detect that. Now, the other attribute is representativeness. You public health officers must be equipped with these attributes if you want to make a very good public health officer. So, representativeness, this reflects the proper distribution of diseases in the sample. You must not be, your system should not be skewed or biased. You get it? we must be representing, it must be representing its target population should be properly represented. Timeliness, rapid data collection and dissemination. This one gives us reliability. It makes the system reliable. You get it? If it can be urgent. Then when it comes to simplicity, there must be easy operation and maintenance. The system should be sustainable. You get it? And it should be easy to operate and easily maintained. Then acceptability, cooperation with data providers and users. Guess who are these? This is the community you are targeting. The community you are targeting must, your system must be acceptable to the community. You get it? And the meaning, you must be well versed with with knowledge about that community that you're dealing with. Then flexibility, it must be able to adapt to new diseases and changing conditions. Must be flexible. Flexibility cuts very many areas, even in geographical location. You get it? Yeah. To new conditions, new areas, new populations. You get it? Yeah. Then ethical consideration. This is very, very crucial in public health. It must protect the individual rights while ensuring public health. You get it? Any PHS, any public health surveillance system, protection of individual rights. Then clear communication about purposes and uses must be there. What is the reason as to why you are introducing this system in the community, and how are we going to benefit from it? Then also ethics will involve you to protect sensitive health data from unauthorized access. This is very, very crucial. You get it? Any data collected from individuals must be properly collected, must be properly protected. You get it? Must be properly protected. Of course, for us to trust your system, with the population, we trust the system that is coming up. You get it? Therefore, yes, we are HIV positive individuals, or we are individuals who are having high blood pressure. We don't want everyone to know that we have high blood pressure. Therefore, protect our data. Ensure ethical guidelines are followed and respect individual rights. I think that one is very, very understandable. Okay. Then Esther, now we are going through the steps to establish a surveillance system. You must give a keen eye to this. Steps involved in establishing a surveillance system. Commitment required is political support, human and financial resources are essential. You need finance, of course. We need funds in case you are to establish this system. Then the human resources. Who are the people involved? Even if there is something like diagnosis of a condition that you as a public health officer may not be able to diagnose, please collaborate with other professionals. Human resources, that's what we mean. Then political support, of course, the political environment is very, very crucial in case you are, because you are introducing something into the community. Therefore, political support is required. Then the steps to establish a surveillance achieves. What are your intentions? What do you want to achieve at the end of the day? Then after defining the objectives, design the system and then disseminate that data. Now, I talked about this at the beginning, that we have data collection, analysis, and then dissemination. And we must appraise this system We evaluate whether there is any impact. You are in a community whereby adolescents, especially those 18 and maybe to 25, they don't want to attend antenatal care. They don't want to go for antenatal. Yet they are pregnant now, are attending antenatal care. You as a public health officer, you are trying to introduce whereby we increase antenatal care attendees from 35% to 50%. So okay, you want to increase to 50%, or even 75% attention. Now we must evaluate this system in the end of the time we have given you, or 2 years has a tendency antenatal care services increased. We are evaluating this system. You get epidemiologists in public health. I told you epidemiologists are advanced public. Okay, next time, please, network variations occur especially in the evening hours. So in case I go off, please you inform me ASAP so that we don't create such breaks in our sessions. Okay. Now, the role of field epidemiologists in public health. Okay, in developed countries, these ones utilize the field epidemiology for public health strategies. Yeah, because they have the resources, they have the funds, even the levels of education, they are better. Then developing countries, these ones need to build human capacity in field epidemiology. We don't have enough funds. There's not yet enough human resources for to carry out this epidemiology. Please, those ones who are mute, let's mute both audio and video. When a video is on, it causes network fluctuations. Please, if your video is on, mute it kindly. So strengthen the field epidemiology capacity, serves critical areas, and here we have response to acute problems. Yeah, response to acute problems. Remember, I told you your patient is the community. Therefore, acute problems are these conditions which will occur in the community, like for 2 weeks, for some days, and even for some limited months. You get it? And they can be solved within that period. Then providing scientific basis for policies and programs. I told you at the beginning that public health surveillance deals with evidence-based decision making. You get it? In case we have funders, in case we want data on something, we can easily get that data we can easily implement our strategies when we have available data to implement our programs and policies. Then another role of field epidemiologists is implementing disease surveillance systems. They're the ones to implement these systems. Then competencies of field epidemiologists. To start with, now you who want to become public health officers, these must be your very good competencies. You must be competent at designing, implementing, and evaluating surveillance systems. Then you must be good at identifying and assessing public health problems. You must be able to carry out community health assessment and community diagnosis to identify public health problems within those communities and assess them. Assessment, I mean determine the level of severity. Is the condition mild within this community? Condition, is it severe? More severe, less severe? Yeah. Then conducting scientific investigation is another competence. You must be good at conducting these investigations. Analyzing and interpreting data. Because in epidemiology, that's what we deal with. You cannot answer the two questions of how and why if you're bad at data analysis, at analyzing and interpretation of data. Then recommending public health actions is also another competence that is required. Then the other is understanding diseases of public health importance. you must be able to identify diseases of public health importance. Different countries have different types of conditions that they take to be of public health importance, by the way. Yes, but a good example here is HIV. HIV is a global health, is of global health importance. I mean, in case we identify a case, we must try to help before this case spreads the condition to other within the entire community. That's why they are even coming up with a vaccine for HIV. I think you are updated with that information. Then malaria and tuberculosis are also of public health, of great public health importance. Then surveillance in the national public health systems. Now we are going now to generally now for the entire country or for the world. These ones you can be supported by WHO, World Health Organization, and World Bank for funding, whereby surveillance is an essential public health function among these ones. Then decentralization challenges, whereby the quality of locally collected data can be improved. Now we are looking at surveillance in the national public health systems. You're developing a system, but your community this time round is the entire country, or even the entire region. You get it? So the solution to the challenge, training local decision makers, national level quality assurance networks, and negotiated core data sets. Yeah, there's nothing new here. Most of this information I've talked about in the previous slides. Now, going to our own now, South Sudan's epidemiological surveillance system. To start with, the IDSR, the Integrated Disease Surveillance and Response Strategy of 2006. This one was adopted by the Ministry of Health and the WHO with the support from the World Health Organization. Its purpose was to strengthen capacities to detect, report, investigate, and respond to priority diseases and public health emergencies. Each one of you is coming from a specific community. I believe you have seen some conditions in your community that you really believe are of public health importance. Now, this IDSR of South Sudan is covering the entire country. You get it? Yeah. So the coverage, it covers all levels of health system from community to national. You get it? Yeah. Hospitals, national referral hospitals, regional referral hospitals, like that. Those are the levels of the health system. Yeah. Then stakeholders in this strategy of 2006, we have the health workers, we have the laboratory technicians, and we have the rapid response teams. Then we have the emergency preparedness and response committees. If you're to come up with a system, by the way, this is crucial. Now, this has given us a very good example. A very good example. If you're to come up with a system, who are some of the essential stakeholders? Health workers, laboratory technicians for any condition related to the laboratory, because you, the public health officer, or you, the epidemiologist, will not go to the laboratory to investigate a parasite in the blood. You get the point? You're not going to the laboratory to investigate a parasite in the blood. Then we have another system of early warning, alert, and response system, the EWAS. The EWAS, yeah. Its focus is on detecting and responding to public health threats, especially in conflict-affected and displaced areas. You know, conflicts in African countries, really, they haven't stopped. They have been there for over years. Get it? Most people have become refugees. They have been displaced to other areas. This is what the EWAS is targeting or is focusing on. It is supported by the Ministry of Health of our country, South Sudan, and the World Health Organization. And it's implemented by the health partners. Its functionality is to collect data from health facilities and community sources, analyzes trends, and triggers alerts for potential outbreaks and guides rapid response. You can categorize this one under one of the types of public health surveillance we began with at the beginning of this lecture. Then its importance of the EOS, it's a vital tool for enhancing health security and resilience in areas with limited and disrupted healthcare access. Then the we have now the public health laboratory in Juba as another public health surveillance system. We have seen these systems. We have those ones which are based in the community. We have discussed those ones which are based in the laboratory. We have discussed those ones which are based on the environment as a whole. And this one can be categorized under those which are categorized, which are under public health laboratory surveillance systems. We saw this at the beginning of this presentation. Its role, it safely manages specimens for diseases like Ebola, cholera, measles, and it performs rapid diagnostic tests. You get it? Here, in case we identify a case with rare symptoms. Now, recently, in certain communities of Africa, there is monkeypox, especially here in East Africa. You get it? So, such laboratories, if they are there, they provide their role is specific on such highly infectious conditions. It is supported by the National Immunization Program, vaccine quality, and safety monitoring. That's its support. Challenges: it lacks a lack of infrastructure, equipment, human resources, and funding. You know, funding is a very crucial issue. If it is available, even these others may not be a challenge. You know that. Commitment, staff dedication to improving performance and delivering quality services. We have now the National Public Health Emergency and Operations Center. Here, please put a keen eye, because from here, you people are going to come and work in these organizations, in these institutions. You people are going to work in these ones because you have received the training. Now, this national public, and even you people can come up with institutions in your own community, public health institutions in your communities. You'll come up with them. After identifying a condition, maybe you may try to report it, or in case there's no clear ideology, organization with the ideology, you may come up with an initiative as a group, as a community. Different communities, communities with the people with disabilities, they have come up with the strategies to simplify their life. People who are lame, people without hands, or people with amputated limbs, they have come up with the strategies to survive as a way of rehabilitation. You get it? So we are discussing these institutions here, not because we want you to learn about them, but you are going to work in them. So position yourself so well. Now coming back, this National Public Health Emergency Operations Center was established in 2018 with the Centers for Disease Control and WHO support. Its purpose is to coordinate preparedness and response activities for emergencies such as Ebola. You know, such conditions are so common in our communities. Then the management system, it deals with the IMS, Incident Management System. The tools for training, the extension for community healthcare outcomes, the ECHO project. It is a Zoom-based platform for training healthcare workers. It is an online-based platform. You get it? These healthcare workers are trained. In case there is any emergency which comes up, they are trained immediately on response. So, if you train healthcare workers, they go on to communities and you train community health workers, VHTs, village health teams. If you train these health workers, they go on to and also train village health teams, and then village health teams reach out to the population, to the final population at risk. Then we have another institution, contact tracing, which came about during the COVID-19 pandemic. It's a vital strategy preventing to prevent and control the spread of COVID-19. Then the teams, it works with surveillance officers, rapid response teams, and key responders. Then the methods it uses through phone calls, home visits, and then community engagement digital tools. I told you that this is one of the strategy for surveillance systems, one of the strategy that was used during COVID-19. If you see an individual who is coughing like this and like this, report them through a phone call or reach out to the community leaders. Or even the community health workers, go on into communities to identify such cases and then advise or refer accordingly. Methods and then the process, we talked about the quarantining for 14 days, testing via the polymerase chain reactions, PCR, very good during diagnosis of COVID-19. Now, at the beginning of this presentation, I talked about molecular based, the ones which are based on molecular techniques or molecular diagnostics. One of them is PCR, a very good one, highly specific. It can identify for you the causative organism as well as the most active stain. You get it? It is a molecular based technique. Then collaborates with the Ministry of Health, with non-government organizations, donors and funders, and then media, as well as the communities. Then we have the South Sudan Public Health Institute, the SUFI. This was established in 2019 through ministerial order, and it manages the Public Health Laboratory and the National Public Health Emergency Operations Center. We have talked about these ones. I don't need to go into further details. Challenges faced by the South Sudanese epidemiological surveillance. To start with, conflict and limited resources. These ones hinder disease monitoring and control. Resources, technology, human resource. Now we are training you people to be public health officers. But initially, we had limited public health officers. In Africa at large, by the way. Human resource, that is human resource. Then even other resources, financial resources, machinery. You get the point. Then remote and inaccessible areas leading to gaps in reporting and surveillance. That one is very easy to understand. Lack of skilled workforce. This one limits timely response. In surveillance, we have timeliness, timely response. I talked about this at the beginning. So if you have lazy who are skilled or less skilled workforce, or we have less timely response. It creates that limit. Then inadequate systems, this one response, really tight conditions. Then global efforts in strengthening field epidemiology. Since 1975, the CDC and WHO have collaborated with over 30 countries to strengthen health systems, whereby programs like the field epidemiology training programs, EFTPs, are crucial in these efforts. So EFTPs provide 2-year training courses to produce motivated professional field epidemiologists. These epidemiologists manage disease surveillance and respond to outbreaks. Remember, we are living in countries which are developing countries. We have a few trained staff or skilled professions in field epidemiology. Then integrated disease surveillance and response, IDSR, we talked about this. This one links epidemiologic and laboratory data to enhance communicable disease response. Then it focuses on district level data collection, analysis, and response. District level data collection, response, and analysis. You can also call it district level surveillance. This one is a decentralized surveillance system, a very good one in disease in identification and response and assessment. Then the key activities of IDSR, we talked about it: case detection, epidemic preparedness, and outbreak investigations. In case a disaster is to occur, it can be identified so early and even be mitigated right away. In case you are to develop a surveillance system, it must also be attached with a mitigation plan. Then the steps for implementing the integrated surveillance response. To start with, sensitize health authorities and stakeholders. Sensitize them. Conduct situational analysis and prepare a strategic IDSR plan. These days, we can see videos on the internet or tutorials which are running on the internet. When schools, remember, schools can have fire outbreaks. Such things really do happen. So, schools train their children, their students, on how to behave during a fire outbreak. You know, fire outbreak is a disaster, and it's of public health importance because it affects the entire community, which is the school this time round. So we conduct a situational analysis, a strategic plan, develop technical guidelines, and train competent personnel, and evaluate the system's performance. Monitor and assess. You examine and evaluate how the system is performing. We talked about this. Allow prompt response to health events. They provide on-the-job training for informal network support. Giving an example, in Brazil, the informal network trainee identified contaminated drugs, leishmania, which led to reformulation and action by other countries. They all took it. Informal network, we may get now. We know that we have a limited task force in the surveillance. We have a limited trained task force. We can get among those ones who didn't receive education in public health, and we give them basics. You get it? This is done usually on public health teams. On village health teams in villages. You get it? We train the informal task force, and we assign them roles. We tell them what to do. Then in the Dominican Republic, the FTP trainee identified a polio outbreak, which led to vaccinational campaigns. And such outbreaks, someone who has identified it, this person is not a public health officer, but is a part of the informal networks. Identifies only one case like this, and it saves the entire country. Now, surveillance and global response to the SARS. Initial detection was in China, November 2002. I told you SARS has the strains. Strains. SARS 1 and SARS 2. Yeah, SARS 2 is the one we have just had in 2019. So initial detection was in Guangdong in China, November. Then it spread rapidly, transmission to multiple countries. Such a condition is a respiratory related condition. It easily spreads just through aerosols. You get it? Droplets. WHO's role in this was it coordinated global efforts and established surveillance networks, came up with surveillance systems. Then field epidemiologists training programs, the FETPs, trainees in China and Canada played a crucial role in surveillance and control. You get it? These programs, we have talked about them. Then effective communication and collaboration led to containment of the outbreak. Effective communication, dissemination of findings, and then interprofessional collaboration. I talked about this at the beginning. Interprofessional collaboration, and then clear dissemination of findings, and also referrals. You get it? Then the avian influenza in Thailand, we are giving you now case scenarios. These ones are very good because they help us to know how we can respond to situations because they have ever occurred somewhere. So this one was an outbreak in 2004. It was a significant avian influenza cases spread from birds to humans. You get it, eh? Avian is something related to the birds, bird population, as in BIRD, the birds, eh? Yeah. So this one, we have very many conditions, by the way. There is cryptococcus, cryptococcal conditions can also spread from birds. So even influenza, now this is influenza of the birds spread to humans, and this investigation, the FETP graduates and CDC partners identified human to human transmission. Now from bird to human to human to human. You get it? Yes. Then global awareness. This included early detection and control measures, which reduced potential global impact. It didn't affect. Now I've talked about the monkeypox currently. Monkeypox is the current public health problem now, which epidemiologists are working on worldwide to see to it that it doesn't become a global pandemic. So, early detection helps us at that. It doesn't become a global pandemic. Then the importance of field epidemiology, effective even without vaccines or high technology systems. You get it? Field epidemiologists, they go on into the community. We have talked about their roles. Then communication, it is an essential for global awareness and response. Dissemination of findings. Please, something has occurred. Communicate. Ebola outbreak in Uganda, that is in 2000 October. So this was a viral hemorrhagic fever outbreak in Gulu district, northern Uganda there. It is the role of the public health surveillance systems, and their role was a quick diagnosis and coordination with the national and international teams. The challenges to this with this outbreak created the rural stigma, political instability, and medical resources shortages. You get it? Usually these conditions occur in areas that are far away, whereby medical resources are limited, even transportation is also limited. Effective containment during this outbreak. Despite the challenges, active surveillance and international assistance controlled this outbreak until it was eradicated. Then the impact, Uganda's experience enhanced its surveillance and response capabilities, leading to the successful implementation of the integrated disease surveillance and response programs. Now, we have had the case scenarios. We have had the case scenarios. We have had the case scenarios in different countries and on different conditions. What lessons do we learn? Under integration, combining data flow with skilled personnel improves the system efficiency. Then under informal networks, it is critical for early detection and response. Informal networks, we have talked about them. Then the SARS, and then the avian influenza. For those who have just joined, SARS is severe acute respiratory syndromes. So it attacks the respiratory system. These ones showcased the importance of international cooperation and rapid information sharing. Learning from past outbreaks, ongoing enhancements in surveillance systems are crucial for managing future challenges. Hope we are together there. You have also your lessons which you have learned from these scenarios, I believe. Then financing and capacity building, we will go forward with our system. Global versus local needs. I've been comparing in my discussion, developing and developed countries. In the developing countries, high disease burden, but often need more resources and political will. You get it? Acceptability and acceptance to fit in that particular community. Politics comes in there. And also resources, available resources. The role of donors and funders, that is assistance in capacity building and funding surveillance systems. We saw that one of the limitations and challenges in Africa for surveillance systems is resources, financial resources, money. Then economic evaluation. Economic evaluation, this one deals with cost effectiveness. How much is required for that system, and what extent of the problem is it solving? You get it? The calculation of the system. That's economic evaluation. Okay? It helps us in cost effectiveness, and cost effectiveness is crucial in public health. Challenges, difficulties in quantifying the benefits of surveillance systems, and the examples, economic evaluations in developed countries, need for similar studies in developing countries. I think this does not need me to go into details of it. It is clear. Role of ICT. We began with the public health informatics at the beginning. I hope you can remember. Now, electronic records automatically, electronic health records automatically send data to public health systems. Now, this is an enhancement in the knowledge. I mean, in how we do things in our systems. If it is electronic, if we introduce electronic ways, it becomes even response becomes easy. Then another role is mobile technology is used for rapid data collection, especially in developing countries. I've talked about this. Wireless internet expands data collection capabilities and access to health information. You can easily give guidelines, and even communication and dissemination of findings become easier if you integrate information and the communication and the technology strategies. Then it enables remote consultations and sharing of medical information. I think this one is clear. ICT integration. If you're to come up with a system, you must also talk about the ICT integration. Public health informatics, surveillance informatics is crucial. Web-enabled software, this one is also to do with ICT. Geographical information systems create up-to-date health maps and the graphs that are accessible via the internet. These ones help us to locate even highly endemic areas. You get it? And on-time updates. Then we have the GPS, the global positioning systems. These ones enhance local data analysis with advanced mapping tools. This is all to do with ICT, sophisticated algorithms, custom data channels. This is all ICT. And as a public health officer, we might not train you in software packages that do all of this, but we have professionals, computer scientists and software engineers who are good at this. So interprofessional collaboration is very, very crucial. Then we have global surveillance networks, WHO framework. This integrates regional, national, and international networks. Then contributors to this, we have the government centers, military networks, and the online platforms. For example, ProMed, APX. These platforms are there. And they are the ones which provide us, whereby you can be in South Sudan and you'll be knowing what is happening in Kenya or Ethiopia or Somalia. These systems are available. These global networks, global outbreak alert and response network. This one identifies and responds to outbreaks globally. Now we know such things really do exist with experience from COVID-19. Challenges and solutions. Economic limitations. This impact on surveillance infrastructure. We have over talked about funding. Then dependency on external research as a challenge. Solutions. Need for collaboration and research support through funding and training. Then developing skilled surveillance and response teams, even if they are informal. We have talked about informal networks, village health teams, we train them. Then creating and maintaining effective surveillance systems. This one, through of course availing funds, a very good solution to most of the challenges. We are winding up, please. I know we have taken, I think, over an hour, but we are winding up. Please don't worry. And then emerging approaches and technologies. Now we are now going forward. We have seen the challenges. We have tried to suggest the solutions. Now going forward, IDSR, integrated surveillance and response. This one for efficient data collection and analysis of infectious diseases. Syndromic surveillance for monitoring for terrorism and emergency responses. We say this one is highly specific and it targets the clinical features of that condition in question. Laboratory-based methods, improving diagnostic accuracy and outbreak recognition. For evaluation of needs, we need data forecasting and cost effectiveness. Data forecasting, using data for temporal and spatial analysis. We can easily predict a disaster which is to happen in the next at least 2 years. We can predict when and where and which populations will be affected by that time. We can predict if we have a good system. Cost effectiveness, now this one is the economics. Yeah, this is the economics we have been talking about. Evaluating alternative surveillance approaches to see that we come up with the best solution within the limit, which can fit within our limited resources. Future directions, continuous updates for faster response, advanced analytics for better prediction, and intervention strategies. Strengthen global health surveillance efforts, because we said a condition that affects Congo, one case like this, if that case is ignored, it can spread worldwide. So now we go on to strengthen global health systems. Addressing gaps in chronic disease monitoring. We talked about that. Then expanding use of the BRFSS. We have talked about this and other methods. Strengthen international health regulations. Current focus on cholera, plague, and yellow fever, common conditions. You get it. Then this is our last slide. Building on still on the future directions. Building consensus on essential surveillance content, investment in infrastructure and use of data for decision making, and then of course use of data for decision making. That's what I meant by evidence-based decision making. Yeah. Then align surveillance objectives with data sources and countries' specific needs. These are future directions. This is going forward now in public health surveillance. Our presentation ends here, and just to summarize, public health surveillance is an ongoing, systematic, and according to the discussion, according to how you have seen the discussion, it's ongoing and systematic. Then data collection and analysis, then dissemination of findings. I hope to stop here with my presentation, and I'll take on one question or two, and then we close.